Hello, so today we're going to be talking about reptiles, drugs, and receptors. So they also have some of like the same types of receptors. So say, I've got a drawing, so say glutamate. They've got a type of glutamate receptor called NMDA receptors, and these are found in humans as well. And basically, ketamine is an antagonist. So stuff like drugs which affect these receptors in humans can also affect can also have the same effects on reptiles because the receptors are present in reptiles. So agonists are stuff that sort of bind to receptors and can activate them, where an antagonist can sort of bind to receptors and sort of interfere with them. So like block other sort of ligands like chemicals from binding to them. So reptiles have got lots of receptors in common, like the NMDA receptors we just mentioned, D2 dopamine receptors, 5-HT2A serotonin receptors. They've got mu opioid receptors and stuff like that. So like some drugs that work, and they've got GABA-A receptors and stuff like that. So drugs which work on these receptors can actually have effects in reptiles as well as in humans. So we'll start with the glutamate receptor. There's multiple types of glutamate receptors. One type's the NMDA receptor. So reptiles have got this, and so ketamine, for example, that's an antagonist for glutamate receptor for the NMDA receptors. So it affects those receptors. So in reptiles, ketamine can have like anesthetic effects. So it's like an anesthesia. Anesthesia. So, and it can, but in some snakes, it can partly cause permanent aggression. But yeah, so the NMDA receptors there. So in reptiles, NMDA receptors are also responsible for like causing behaviors and stuff like that. So that's interesting. So then if we move on to, so in the last episode we talked a bit about nociception and pain. So maybe you can't 100% say that reptiles feel conscious pain and not just nociception. So best to just assume they can't feel pain, because obviously if they don't, then you can't really, So if we look at tramadol, which tramadol actually reduces sort of like pain or nociception or whatever in reptiles. So that's interesting. And then in as well as so that binds to mu receptors, which are opioid receptors. So if we move on to the so benzodiazepines also have effects. So benzodiazepines work on GABA-A receptors, and GABA-A receptors are also found in reptiles, like the NMDA receptors and mu receptors that we've just talked about. So if you look at stuff like midazolam, that's been used on some reptiles, and it's thought to like sedate them, and it's also been like thought to have like reduce aggression and cause muscle relaxation in reptiles. These benzodiazepines, which midazolam is a type of benzodiazepine. So they're they're agonists for GABA A receptors. So next, if we move on to, so they have like, well, one other thing is, can reptiles hallucinate? So, and so like, I don't think it's really known, but they have receptors involved in sort of like hallucinations from psychedelics. Like they have ketamine's apparently a psychedelic as well, which affects the glutamate receptors. But if you look at like the ones like LSD and stuff like that, they affect the 5-HT2A receptors. So and reptiles have 5-HT2A receptors. So it could possibly cause hallucinations in reptiles, but it's not really, I don't think it's been observed of reptiles that are having hallucinations, so it might not cause them. But yeah, so what's interesting is SSRIs, which are like selective serotonin reuptake inhibitors. So they prevent like the reuptake of serotonin. If you give like some lizards SSRIs, and it'll probably work on reptiles in general, but it causes, like, it decreases aggression in them, so it actually affects like the dominance hierarchy, because if they're not being aggressive with each other, they can sort of lose their like position. They can lose their sort of like status in the dominance hierarchy sort of thing. So that's some receptors. And so like if we're saying about hallucinations, so like antipsychotics, so like they can, well, the first and second generation antipsychotics, they work on D2 receptors, so they're like antagonists for them, so they decrease dopamine. So D2 is a dopamine, a type of dopamine receptor. So what they basically do, so they can cause like lots of effects in humans, like to do with movement, to do with like an increase prolactin levels and stuff like that. So although they might not necessarily reduce hallucinations in reptiles, because we don't know if reptiles have hallucinations, they probably have effects, or they're dopamine related effects on reptiles. So you can see the picture. So I've got a sleeping gecko with blood turning into rose petals. So just do with tramadol, because obviously that can make you feel good as well. So and then we have sort of stuff. I've included a line of calcium powder at the bottom. So that's just a jokey thing. I don't think it has a psychoactive effect on reptiles, calcium powder. So it doesn't. Yeah, I don't think that's psychoactive. So that's the receptors. Oh, and when say like you have like different type of receptors which the ligands, like the chemicals, bind to. So you have ionotrophic receptors and metabotrophic receptors. So in ionotrophic receptors, you have the ligand which binds to it, and then it like opens the channel and lets ions in. And then in metabotrophic receptors, you have it sends a signal, like when it binds to a receptor, it sends a signal to another receptor, and then that causes and the second receptor which receives the signal from the first receptor. It's that receptor which opens up and lets ions in. So, thanks for watching. I hope you enjoyed. Enjoy your day. And if you've got any questions, just leave them in the comments. Right, thanks, bye.